Good morning. In the previous presentation, we have discussed about joint diastole, atrial systole, ventricular systole, diastole, ventricular diastole, and joint diastole. Now, the sequential events in the heart, which is clinically repeated, it is called as the cardiac cycle, and it consists of systole and diastole of both the atria and the ventricles. As we have discussed earlier, the heart beats 72 times per minute. That is, that many cardiac cycles they are performed per minute. From this, it could be deduced that the duration of a cardiac cycle is 0.8 seconds. And during a cardiac cycle, each ventricle, so it is 0.8 seconds, and during a cardiac cycle, each ventricle pumps about 70 ml of blood, which is called as stroke volume. The stroke volume multiplied by the heart rate, that is number of beats per minute, gives the cardiac output. So therefore the cardiac output can be defined as the volume of blood pumped out by each ventricle per minute, and it averages around 5000 milliliters or 5 liters in a healthy individual. So the body has the ability to alter the stroke volume as well as the heart rate, and thereby the cardiac output. For example, the cardiac output of an athlete will be much higher than that of an ordinary man. So during each cardiac cycle, two prominent sounds they are produced, which can be easily heard through a stethoscope. And the first heart sound, that is lub, is associated with the closure of the tricuspid valve. Okay, closure of this tricuspid valve, and bicuspid valve also. So, and the second heart sound, that is dub, that is associated with the closure of the semilunar valves. Okay, so these are the semilunar valves. So it is associated with the closure of these semilunar valves, and these sounds they are of clinical diagnostic significance. Now the next important topic is about electrocardiograph. We all are familiar that the scene from a typical hospital television show, a patient is hooked upon a monitoring machine, and that shows a voltage traces on the screen and makes the sound pip pip pip, and as the patient goes into the cardiac arrest, this type of machine, which is electrocardiograph, okay, it is used to obtain an electrocardiogram, that is called as ECG. ECG is a graphical presentation of the electrical activity of the heart during a cardiac cycle, and to obtain a standard ECG, I'll show you the figure of ECG first, then I will explain all the points. So this is a typical ECG, and this is the machine through which this ECG can be taken. So to obtain a standard ECG, as shown in this figure, a patient is connected to a machine with the 3 electrical leads, one to each wrist and to the left ankle, and continuously monitoring the heart activity. For a detailed evaluation of the heart function, multiple leads are attached to the chest region, and here we will talk about a standard ECG. Each peak in the ECG is identified with a letter from P to T that corresponds to a specific electrical activity of the heart. The P wave, P wave represents the electrical excitation or depolarization of the atria, and the QRS complex, this one, it represents the depolarization of the ventricles, which initiates the ventricular contraction, and the contraction starts shortly after Q wave and marks the beginning of the systole. So the T wave represents the return of the ventricles from the excited to the normal state, which is called as repolarization, and the end of the T wave marks the end of the systole. So by counting the number of QRS complex and that occur in the given time period, one can determine the heartbeat rate of an individual. Since the ECGs obtained from different individuals have roughly the same shape for a given lead configuration, So any deviation from this shape indicates a possible abnormality or disease. Hence, it is of great clinical significance. Now, next topic is double circulation. The blood flows strictly by a fixed route through the blood vessels, the arteries and the veins, and basically each artery and vein consists of 3 layers: an inner lining of squamous epithelium, which is called as tunica intima, and a middle layer of smooth muscles and elastic fibers, which is called as tunica media, and an external layer of fibrous connective tissues, which is called as tunica externa. So the tunica media is comparatively thin in the veins. Now, we have seen that the blood pumped by the right ventricle enters the pulmonary artery, and this pathway continues as a pulmonary circulation, and the oxygenated blood enters the aorta is carried by a network of arteries, arterioles and capillaries to the tissues, from where the deoxygenated blood is collected by a system of venules or veins and vena cava and emptied into the right atrium, and this is a systemic circulation. So the systemic circulation provides nutrients, oxygen and other essential substances to the tissues and takes carbon dioxide and other harmful substance away for elimination. So a unique vascular connection exists between the digestive tract and the liver, and that is called as hepatic portal system. The hepatic portal vein carries blood from intestine to the liver before it is delivered to the systemic circulation, and a special coronary system of blood vessels is present in our body exclusively for circulation of blood to and fro from the cardiac musculature. So you can see here that how pulmonary artery and pulmonary veins, they are associated with the upper 2 atria, and ventricles, they are generally releasing these pulmonary artery, and pulmonary artery is getting the blood from the ventricles and pulmonary vein is getting it into the atria. So this is how circulation of blood takes place through the different body parts. Regulation of cardiac activity. Now, normal activities of the heart, they are regulated intrinsically by autoregulated or specialized muscles, which is also called as the nodal tissues. Therefore, the heart is called myogenic. And a special neural center in the medulla oblongata, which can moderate the cardiac function through the autonomic nervous system. Now, neural signals through the sympathetic nerves, that is part of the autonomic nervous system, they can increase the rate of heartbeat, the strength of the ventricular contraction, and thereby the cardiac output. On the other hand, parasympathetic neural signals, which are another component of the autonomic nervous system, they decreases the rate of heartbeat. So the speed of conduction of action potential and thereby the cardiac output. Now, adrenal medullary hormones, they also increases the cardiac output. Now, lastly, we'll discuss about the disorders of the circulatory system. High blood pressure or hypertension. Hypertension is the term for blood pressure that is higher than normal, that is 120 by 80 mm of Hg. In this measurement in millimeters of mercury pressure is the systolic or pumping pressure, and 80 mmHg is the diastolic pressure or the resting pressure. So if repeated checks of blood pressure of an individual is 140 by 90 or higher, it shows hypertension, and high blood pressure leads to heart disease, and also it affects the vital organs of the brain or the kidneys. Coronary heart disease, which is also called as CAD, or it is also referred to as atherosclerosis. It affects the vessels that supply blood to the heart muscles. It is caused by the deposits of calcium, fats, cholesterol and fibrous tissues, which makes the lumen means the cavity inside lumen of the arteries narrower. Next is angina. It is also called as the angina pectoris. It is a system of acute chest pain which appears when no enough oxygen is reaching the heart muscles. So angina, it occurs in men and women of any age, but it is more commonly among the middle-aged and elderly. It occurs due to conditions that affect the blood flow. Then lastly, it is heart failure. Heart failure means the state of the heart when it is not pumping blood effectively enough to meet the needs of the body. It is sometimes called as congestive heart failure because congestion of the lungs is one of the main symptoms of this disease. So heart failure is not same as that of cardiac arrest when the heart stops beating, or a heart attack. So what is heart attack? When the heart muscle is suddenly damaged by the inadequate blood supply. So these are the separate terms of cardiac arrest and the heart attack. So cardiac arrest is when the heart stops beating, and heart attack is when the heart muscle is suddenly damaged by the inadequate blood supply. So that is all about this chapter. I hope everything is clear. You can always send me the message for your queries. Thank you so much.